Hi, everybody. I'm Jack Martin, Executive Director of the Providence Public Library, and I'd like to welcome all of you to the Donald Farish Auditorium here at the newly renovated Providence Public Library in downtown Providence. Tonight's event is largely in part of PPL's Conservator Society. They are among our most enthusiastic and devoted supporters, so I wanted to thank all of you who are out there who are part of our Conservator Society for watching this tonight. But also I want to extend a warm welcome to everyone else who is here joining us from Rhode Island, Massachusetts, across the state and the nation. So thank you all for joining us. I'm joined here tonight by my two esteemed colleagues, Dr. Ashish Jha from Brown University School of Public Medicine, and also Dr. Joe Mizell from Brown University Libraries. And I'm just gonna put on my glasses because the lights aren't quite bright enough for me to see this, so I can read you their brief bios. So Ashish K. Jha is recognized globally as an expert on pandemic preparedness and response, as well as on health policy research and practice. He has led groundbreaking research around Ebola and is now on the front lines of the COVID-19 response, leading national and international analysis of key issues and advising state and federal policymakers. He has extensively researched how to improve the quality and reduce the cost of healthcare, focusing on the impact of public health policy nationally and around the globe. Dr. Jha is currently the Dean of the School of Public Health at Brown University. Welcome, sir. Dr. Joe Mizell was appointed as Joukowsky Family University Librarian at Brown University in October 2018. He came to Brown in 2010 as Deputy Provost and provided leadership for an array of initiatives to strengthen academic excellence at the library. Between 1999 and 2010, Mizell served as a program officer for research libraries and humanistic scholarship at the Andrew W. Mellon Foundation. He received AB and PhD degrees in history from Columbia University and has written 3 books as well as other scholarly works on 19th and 20th century Britain. A fellow of the Royal Historical Society, Joe. Joe is also an adjunct associate professor of history at Brown. So this is the part where I get to introduce myself. So Jack Martin, executive director, has more than 25 years of experience in the library field. For those of you who don't know, my mom volunteered me to work for my local public library in Cornelia, Georgia when I was 13 years old, and here I am. And I have basically worked my way up and down the East Coast. We just completed a $28.5 million renovation here at the Providence Public Library, transforming both our programs and services as well as our building. And we have launched an exciting new educational mission here at the Public Library for youth, for adults, as well as for children. And what my bio does not state is that I live at home on the east side with my husband and 3 kooky cats. So Christina Bevilacqua, who will be moderating the chat here, she is a cultural curator who uses the arts and humanities to cultivate conversation amongst diverse audiences. Since 2017, she has been the programs and exhibitions director here at Providence Public Library. And then behind the scenes, but never behind the scenes, Janaea Kizzy, events coordinator here at Providence Public Library, is an archivist, historian, and artist. Her first archives internship was here at PPL, and she volunteered in PPL special collections for 9 years while working on archives at the American Academy of Arts and Science, Citizens Bank, and the Concord Free Library. So now you know who will be joining us today, and I think the run of the show will, I think Dr. Jha will give us sort of an update of where we are with the pandemic. And then I think we're going to have a conversation about libraries and civic institutions. So I'm going to just turn it over to you, Dr. Jha.
Great, Jack, thank you. And I'm going to stand and walk over here. So I think it's just easier, and I hope you can all see me. Here we go. All right, good. So I'm going to spend about 15 minutes or so giving all of you a sense of where we are with the pandemic, both where we are and I suppose more interestingly, where we go. And in that, I want to make sure that we cover some of the really important issues facing our society, such as the issue of misinformation and disinformation, and how we strengthen civil society institutions like libraries to become part of the solution. And my hope is that that becomes the way that we get into a broader conversation. Sounds like I need to lift up my mic. All right, I'm hoping you all can hear me. Okay, so where are we with the pandemic? Here we are, February 8th, 9th, somewhere. Eight,
Close enough.
right. So let's start off with some good news on where we are in the United States and actually around the world, which is that the Omicron surge that started getting going in early December is clearly has peaked and the worst of it is behind us. Nationally in the United States, infections are down about 70%, hospitalizations are down about 30%, and deaths have peaked and are plateaued. And since we know that deaths lag by about 3.5 weeks after infections, and since infections peaked about 2.5 weeks ago, we can predict pretty reliably that we're going to start seeing a decline in deaths in the United States in about a week or so. That's national. Of course, it varies a little bit from place to place. Here in Rhode Island, I would argue the infection numbers are not only just down dramatically, but we may be getting close to the pre-Omicron surge levels in terms of infections. And again, hospitalizations and deaths will come down as well in the upcoming weeks. So that's the good news. The good news is that the Omicron surge, which has been pretty horrendous in terms of numbers of infections and hospitalizations and deaths, has peaked, is largely behind us. And that pattern that we described in the United States, in Europe, their infections are again down about 20%. India has turned the corner. Brazil has turned the corner. The Omicron wave has been ripping through the entire globe, and pretty much everywhere it has peaked and has started turning in the right direction. Some places a little further along than others. All right, so that's kind of where we are at a high level. What happens next? What should we expect in the weeks and months and years to come? It is very tempting at this moment, 2 years into this pandemic, to say it's over. The pandemic is over, we're ready to move on. That would be, I think, a misunderstanding of the moment we're in. And so what I'm going to try to do for the next few minutes is lay out both the challenges ahead and why I remain very optimistic that we can manage them. But being optimistic that we can manage them is not the same thing as saying we can just ignore them. So let's talk about what is, if Omicron remains the last variant we see, which I think is highly unlikely, we should expect a surge of infections again in the summer in the South, as we have seen into the last 2 summers. We should expect a surge of infections next fall and winter here in New England, and really across all of Northern America, Northern United States. And the virus is going to be with us probably forever. It will continue to evolve, but it will be a challenge for years to come. That's if there are no new variants. Everybody that I speak to, every piece of data I look at, suggests to me we will see more variants. We may see many more variants. We all hope that is not the case, but for new variants to emerge and really take over, they have to be even either more contagious, more immune evasive. The problem is this virus is not done evolving, and we are going to have difficult, or we're going to have some challenging versions of the virus to deal with. Well, that all sounds really depressing, and then all of a sudden it makes you start feeling like maybe we're just in this pandemic for a very long time. So let me give you the good news. The good news is while the virus is going to do what it's going to do, we don't have to stand still. And in fact, we should not be standing still. What we should be doing is stop worrying about predicting exactly what the virus is going to do when, and get into the preparation business. So get out of the prediction business and get into the preparation business. Let's assume there are going to be surges. Let's assume there are going to be variants. And by the way, if there are not, terrific. But let's assume that's coming. So what do we need to manage future surges and variants in a way that doesn't shut down schools, doesn't fill up hospitals, doesn't lead to thousands of Americans dying every day, allows us to have events like this in person? So it is absolutely terrific that a few of us are together in person, but most of you are at home. And by the way, remote options are always terrific for increasing access. But I'm confident there's some of you who would love also to be here in person. How do we get to that? And how do we do that in a way that allows us to do that no matter what the virus does? So we now know a lot about how to improve or how to manage this virus. And I want to talk about 2 sets of strategies. First, let's talk about how the virus spreads. We know it's an aerosol, airborne virus, and it spreads in places that are indoors, that have poor ventilation, where people gather unmasked. One strategy is you could keep masking forever. I think people get tired of that, and that has a limited shelf life. The second thing you could do is you can make dramatic improvements in indoor ventilation. And what's interesting to me is I think about the fact that for centuries, polluted water killed people. It still does in many places in the world. And yes, we used to tell people like boil water, do all these other things. But eventually we realized that the solution was not to get people to change their behavior. The solution was not to get people to stop drinking water. The solution was to clean the water. And now I open up the tap and I largely don't worry about, is this water going to kill me? And instead, I feel reasonably confident that we have figured out how to keep water clean and flowing. It's time we do the same thing with air. We have got to figure out how to make indoor air clean. We have not thought about this very much. We think about it only in the most extreme moments when you have smog or sick buildings. But in fact, indoor air quality is a profound sort of predictor of everything from mood to cognition to spread of viruses. We have paid very little attention as a society. We can fix them. And what experts tell us is that we can make indoor air as clean and as safe as outdoor air. And if that's true, then all of a sudden indoor gatherings can start becoming as safe as outdoor gatherings. So it's not going to be easy, it's not going to be overnight, but that has got to be a major part of our strategy for managing this virus and other respiratory viruses. So ventilation filtration, I still think masking is going to have a role during surges. I can imagine, let's say it's November of this year, there's a new surge of infections in Providence. I could imagine the governor or mayor coming out and saying, hey, indoor mask mandates for 4 weeks while we deal with this surge. That would be very reasonable. And masking intermittently during surges to keep infections low can become a normal part of something we do. Not mask all the time, not throw away the mask and never deal with it again, but instead use it infrequently, strategically, temporarily to keep infections low. Those, I think, are going to be really important strategies. There's a whole set of other strategies I want to spend a couple of minutes talking about. And then I want to finish with really talking about misinformation and disinformation. So beyond ventilation masking, what else needs to do? The good news is we have made phenomenal progress on the biomedical side of these things, right? So we now have cheap tests, not cheap enough, but cheap tests that are widely available. Before I came into this building this evening, about an hour before, I got one of those antigen tests. I swabbed my nose. I tested myself. I was negative. That makes me feel so much more confident sharing the stage with my colleagues, knowing that I am very, very, very unlikely to be infected. That's critical. Those tests should be cheap and widely available. And imagine that during the next surge of infections, hundreds of millions of those tests are sent out. They become widely available in libraries. Anybody can walk in and pick up 4 boxes. That's what we want to get to. And there is no reason we can't. We have the technology, we have the resources, and we've just got to execute on them. If tests became widely available, it would have, again, a profound effect. We could all gather in a well-ventilated room, everybody test themselves, we'd know immediately that people in there were sick. So testing becomes really important. Vaccines, haven't discussed it yet. Vaccines have been a major source of improvement for the safety of this against this virus. For those of us who are vaccinated and boosted, and if any of you out there are adults who have not yet gotten vaccinated or have not gotten boosted, please do. It is absolutely critical. It'll prevent infections, but much, much more importantly, it dramatically reduces your risk of getting sick and dying. And we have got to get to a point where most people are vaccinated and boosted in our country. Got to keep plugging away at that agenda. Last but not least is therapeutics. Has not gotten as much attention as necessary. The good news now is we have monoclonal antibodies that work against Omicron. Only one, but more coming. We have oral pills that work. We don't have enough of them. We're working on production. So imagine it's that November scenario, it's a surge of infections. Imagine we're all gathered here one evening together, celebrating the Providence Public Library, and somebody slips through, ends up having a negative test, but was still positive, and 5 people end up getting infected. Not great, everybody vaccinated, boosted, people are gonna do okay, but one person ends up having a bad course. They call their physician the next day, get a prescription for oral Paxlovid, plenty available at the CVS. They get their 5-day course, they end up doing fine. That is part of the strategy. We want those therapies widely available So for those rare instances where a breakthrough infection is actually quite serious, we will have treatments to take care of people. Put that all together as a package, and my take is, I'm ready for whatever Mother Nature has to throw at us. We're going to have to make improvements to our vaccines for the long run. That's fine. We've got the technology, we've got the science behind it. But the bottom line is that we are no longer in March of 2020. February of 2022 looks very different. It now has given us the tools to deal with this virus in a way that lets us do things that really matter. Finally, I want to finish with one of the most important and challenging issues all around, which is, so given all of this, why aren't we there already? And one of the major things that holds us back as a society, as a country, is the sheer amount of misinformation and disinformation that continues to poison the public discourse, makes it hard for people to know what is right and what is wrong. It's a huge challenge. It's a huge challenge, and something that all of us who communicate with the public struggle with. And here, what I think is we need to do a few things. First, we absolutely need better science and information about why misinformation spreads, who creates it, why do some things stick and others not. We don't have that kind of training in public health. We have been part of the problem. We have done a poor job of communicating, and we've done a bad job of countering misinformation because we don't have the tools to do it. So that, I think, is a critical piece of work that needs to be done. And an area where Brown School of Public Health and Brown University is really taking a lead, launching a whole set of new activities there. Second, I do think there's a responsibility of platforms, Twitter and Facebook, to not give host to true disinformation. There's plenty of stuff where reasonable people disagree, but there are things that are just factually wrong. And there is no reason to give platform to that. And I think the social media companies have to do a better job. And last but not least, and I'm going to finish with this, is about strengthening civil society's institutions, like libraries. So one of the things we've learned in this pandemic is that misinformation finds fertile ground when there is an information vacuum. When people don't know whom to trust, don't know where to go, don't know how to get good information. And the best way to make misinformation sort of not find that fertile ground, the best way to counter it, to inoculate people against misinformation, is to give them access to trusted, good information. And there are two parts of that, right? Good information, trusted. And civil society institutions, and there are many of them, universities are one, libraries are another. So not government institutions, not private sector business institutions, which also both have important roles. But that third group, the civil society institutions, they are trusted by large proportions of the population. They can be a powerful source of good information to counter the moment we are in. And we have to find ways of strengthening those institutions. And so when I was asked to come be a part of this evening, I was delighted because I really think of PPL as one of those absolutely critical civil society institutions that we have to bolster, that we have to strengthen even further, and to ensure that it continues to play this very trusted and useful and helpful role in our community. So thank you all for letting me be a part of this evening.
Thank you, Dr. Shah. I think that it's safe to say that, I think a lot of us are probably not looking forward to the potential variants and things that may be coming down, that could come down the pipeline. But I think I think what you said about what the possibilities are about being proactive and getting on the offense of this pandemic is really positive. So thank you. I really appreciate that. And so you did a great job of sort of segueing us into this conversation about civic institutions. So I'm going to throw this question out to you, but I think you should totally chime in as well. And then I can talk about from a public library experience as well. So how have civic institutions such as libraries held up during the pandemic? What role do libraries play in situations like this?
I think libraries play a variety. I think libraries play a variety of roles, and I think one of the really important ones, going to Ashish's point, is that we are trusted. We are open spaces. We are not spaces of judgment that can scare people off, and we're places that basically anyone can come into in our environments and become better informed than they were. And there are multiple resources. There are people who can help you locate information about questions that are of interest or concern to you. Again, I think to the point of how do we combat misinformation or help people become better informed, libraries are the space that creates that kind of opportunity with very low barrier to entry.
Thank you, Joe.
Again, both of you have so much more expertise on this than I do. So at the risk of saying something naive or obvious, a lot of people who are outside and don't think about kind of libraries deeply think of libraries as just places of information. Right? But information is not random or neutral. Information needs to be curated. And how that information is curated, what information is brought forward, how information is shared with people is all very, very powerful tools. And it strikes me that there is an opportunity that many libraries have taken, but maybe not all, to think about how do they become sources of good information. Because in this world of constant flow of information, the problem no longer is that people don't have access to information. It's a really struggle with weighting and how do you value some pieces of information over others. So I'd also be curious, and I know that you're asking the questions, but I'm just going to put out there, like, there's a fine line there between curation, helping people, versus becoming what might be perceived as heavy-handed. Or I'd be curious how both of you have thought about that in your different roles and institutions. Of how do libraries play a helpful role without getting to a point where people no longer see them as safe space for multiple ideas?
So I actually think this conversation is a perfect example of how libraries can provide accurate and trusted information. I mean, this is our second conversation, I think, around the pandemic, and we've been able to bring in experts from the state and from New England to really help educate our members and the public. So I think libraries as conveners of great and trusted information is actually a terrific way to go. But then also to Joe's point about coming to us as trusted institutions, I actually, it's really interesting. We actually had a partnership with Roger Williams University a few years ago where law students actually came in to give new immigrants legal advice on how they might, and this was during, everything that was happening with immigrants in the last 4 or 5 years, but that was a tried and true. That was, those folks trusted the public library because it was an open space and they could be anonymous and they could ask questions. So I think that is exactly the type of role that libraries can play.
I agree with everything that Jack has said, and there are many different types of libraries, and we represent two kinds. They're not hugely distinct, but they do have particular missions. So a public library, in Jack's case, and an academic library that's part of a university. So our main constituency is students and then supporting faculty researchers. But it's important to remember that students come from all over, and they come in formed by their own backgrounds and come in with a lot of ideas and interests, and helping teach them in the course of their education and formation while they're at the university about the ways that information can be more or less accountable. And I think that's an important thing. The most egregious misinformation is really not accountable to anything. It speaks its own point, and without reference or even concern about reference to anything else. In an academic library like ours, but I believe it's absolutely true for institutions like the PPL, it's not as though you bring in all these different sources of information and they all line up and agree, right? Part of the exploration, part of becoming better informed is to be able to test one piece of information against another. And I think that is, again, the great opportunity that libraries present by bringing things together for people that way. So I think from the perspective of an academic library, we really look for accountable information, or if it's information that is sort of the kind that is a piece of disinformation, that we want to have that, to look at it, to study it as an academic institution, so that we do understand these issues. We do understand how these things work, and we understand more about what's going on in our culture and our society by looking at these artifacts, but understanding what they do and they don't do as pieces of information, if I could put it that way.
So it's interesting because we talk a lot about curation here at Providence Public Library, but we've recently, not recently, I would say the past 2 years, we've really been talking about how we can be a platform for community voices. And I think one of probably the coolest things that we did during the pandemic was we created the COVID-19 archive with the Rhode Island Historical Society. And I can't say it's the most accurate information, but it's accurate information from the voices of the community. And we now have hundreds of digital documents from elementary school students, from college students, from everybody in Rhode Island who's been experiencing the pandemic. And that's been a really just eye-opening opportunity for us to partner with the community to co-curate the space. Really, really interesting, I have to say.
And that's going to be very important for the future, for understanding pandemics, understanding how people respond, understanding social formations around it. And your institution and mine both have lots of collections deeper back in history about other diseases, other pandemics, other epidemics, and those can also be, I mean, I'm a historian, so this is naturally what I gravitate to, but as part of that kind of scientific investigation of how these processes work and unfold, there's probably a lot about the playbook in each case about disinformation or misinformation or simply confusion that one can look at comparatively and extract things that can inform the science going forward next time.
It's great. What you described what you've been doing, I think, will be a valuable source of information. Part of it is most people don't have a sense about it. It's one of the things pandemics do is they break the kind of normal, common connections and bonds that people have. We don't see each other that often. We do it in very artificial ways through Zoom or in other ways. And so it's hard to know what's been happening in people's lives because it's been hidden. And by making that through digital technology more plain, I think you actually give much more humanity to the experience of the pandemic. I think it's fantastic, and I think it'll be a great source of knowledge and insights for years.
We think so too, and we had a really fun conversation last week, Joe, about sort of other sort of historical things that are artifacts that our libraries might have, and I think you had a couple from Brown, but I remember so we just started the about 3 years ago the Rhode Island LGBTQ archive. And there is a lot of documentation about the AIDS crisis and pandemic of the 80s. But then on a weirder side, I found out that we have a lock of hair from someone that died of dysentery in the 1890s. So I don't know if you have any strange things that you want to throw out to just share with folks out there.
Well, some of the things that I've been interested in when the pandemic landed, one of the first things that we heard from the university leadership was the president sent me an email and said, "What do you have about what Brown did in 1918?" And so we went back to the archives and looked at that. But many interesting things. I think we have information that probably dovetails nicely with yours about AIDS disinformation. during the AIDS epidemic. We have materials on things like, anti-fluoridation campaigns. I mean, just we become these repositories of so much, but when we have the questions to pursue, then these materials take on new meaning and get activated in different ways. So I think as part of the kind of research initiatives that you've been talking about, Ashish, I think I would always advocate for the historical dimension. If I could add another point, you mentioned the digital environment from the kind of archive you were creating. And one of the things that I think is very new in our environment about the separations of pandemic and mass disease is social media, which in one way has been this great transmitter of misinformation and disinformation, but it's also a great scientific tool. So in my library, we've worked with a faculty member of yours who was harvesting Twitter exchanges in an effort to understand concerns focused on Black maternal health and the effects of COVID. And so this was a way of kind of crowdsourced data gathering just out of the morass of Twitter to really identify these specific concerns and help inform different kinds of interventions in this moment. And so this is a way that the connections that the digital environment allows also allow us new insights to the science and the society of what we're experiencing.
I think that's fascinating. I hear a lot when I talk with other people, do we even need libraries anymore? And when I hear, conversations about, how we're using social media and the digital world to create and provide more access, it's just really exciting to me. So, I guess one of the questions that I always get is, what are libraries here for? And what has a pandemic taught us that libraries are here for? I'm happy to jump on that first if you want, but.
Well, I would love to hear what you have to say.
Well, so for us here at PPL, March 16th, 2020, we shut down and we immediately found ourselves delivering laptops and hotspots to all of our learners across the state. And we have learned that the technology divide is humongous out there, that people do not have access to the internet. They do not have access to devices to use the internet. And that is a huge disservice. And it is all, it's social, it's racial, it's all of our, there's so many underserved communities that are not able to access information because they don't have technology. And so I get the question all the time, well, you must not even need public libraries anymore because, well, we have ebooks and you have Amazon. And I tell people that, well, you must be a middle-class person who can actually afford the internet at home and afford a laptop and afford an e-reader. But there are so many people out there in our communities here in Rhode Island and across the country that they can't afford to do that. And the library, the public library to me, is the last vestige of something that is free in the country. So I would invite, if you need us in that way, if you don't have other access to this information, please come. But if you can afford it, then you should just come to the library, to public libraries, because they're free, and it's an opportunity for you to learn and for you to better yourself. But you would never believe the number of times I get the question where, why do we need public libraries?
It's so important. And, I think we had a very interesting version of that in our situation at the university, which was when all the students went remote, we scrambled to provide all the course materials digitally, make sure that was all available, do everything we could to support academic continuity. But again, a fair portion of our students had real technology challenges, and this was difficult, or even being in environments, if they had a computer, where they could actually focus on what was going on in the computer. We also found out there were staff when everyone went to remote work for a period. And we tried to find ways for everybody to do remote work. Staff who did not have computers at home, library staff. So, the digital divides became manifest. One of the really rewarding things that came out of this experience for us is when the library had to go away for a period. We heard so much from students, from faculty, about the value that our library has to their experience on campus. And we knew we had lots of people coming in all the time, but I think it really underscored how important it was. The services, the resources, the people, but also the sense of place. And I think that goes back to what we were talking about earlier, Jack, that this is, an environment that people can come in and kind of, with help or independently, make their way through information that informs them on the things they want to know or need to know. And so I came to be even more of a believer in the physical library as a result, even though a lot of our digital trends have accelerated considerably and positively, I think.
Well, I think to Ashish's point earlier, I think there's a question, are we going to be in person or are we going to be virtual? I think we're going to be both. Because,
Absolutely.
We've, even with events like this, we've discovered that, all our core audiences will show up, but then we have, a national and often even international reach. So I think that's, a huge thing that we've learned over the past 2 or 3 years. I don't know if you had anything else you wanted to add to.
Listen to both of you talk about it does strike me. I get why people ask you the question, because I think it seems rational as long as you don't think about it. But the moment you start thinking about it, I think your issue of access is huge, and there are large portions of our society that don't have access, and we often forget about that. But it also seems to me that a big part of it, something we talked about and touched on earlier, which is for everybody else, information is widely available. Almost anything you find in the library, not everything, but a large majority of it, you can find some version of it somewhere online. That's a different thing than what libraries are. So there's the physical space of bringing people together, creating a space for getting that knowledge. But there is also, and both of you have said this, the people who are here will help you navigate that, will help you ask clearer questions, right? Who do a much better job of figuring out what you actually want than Google does. And then steering you to the right place. That you can't get from the internet on its own. So even if you have access, you can't get that from Amazon. You can get the book you want, but which book do you want is not a question that I think Amazon answers very effectively, or often answers in a very bad way. That remains to me one of the many ways in which libraries remain really critical to societal institutions.
It's true. We give great reading recommendations, I have to say. And someone in the group tonight pointed out that we actually have a staff recommendations section downstairs. So
and actually, it's not built on algorithms, which algorithms have a lot of value, but they actually also get us going down a lot of wrong paths. And what these are not algorithm-based recommendations. These are the people who work here who make this place work and run. This is their recommendations. I don't know. There's something very powerful.
No, it's great, and I have to say that's like one of the most popular sections of of the downstairs browsing area is that staff selections, and you can put out the junkiest, oldest looking book, and people will swipe it right off the shelf. It's pretty amazing. I think the other topic we wanted to talk about is we've sort of been chatting about it already, is access. And what have we learned about access? How has access to libraries evolved? And how do we make resources available? I think we talked about that some now with using digital and social media, with events like this, sort of moving into the digital realm or the virtual realm. But I don't know, has Brown been looking at any other sort of arenas?
Well, I think for our mission in supporting research and public health research in particular in this setting, one of the things that we grapple with is that the information economy is not free. And there are many times where our library experts have to really help our researchers get things that they need for their science or their clinical work that might not be so easily available. It might be paywalled in a way that is difficult or other things. And they have demonstrated that they have some skill sets in helping researchers get things that they desperately needed in a time-sensitive way, particularly early in the pandemic, and really tapping into a global network of libraries too, to see where they could actually get an accessible version of this. And I think for our kind of library, that's a very important part of the story, as well as the skill sets to not have researchers spend time figuring out what is the universe of relevant studies for the question they're trying to pursue, but in public health, where that could be across many fields, having the librarians who can curate that set of information so that the researchers can then go on and solve the health crisis.
I really enjoyed hearing about that last week when we were chatting, and I had never made sort of the leap in my brain as to how important as to the role that the libraries have played in supporting the School of Health. So I thought that was really really terrific. I think here at PPL, with this renovation, not only do we have the expertise of our staff, but we also have a really nice place to kind of hang out in and actually study. So I don't think that we can ignore the power of just having a comforting space to actually do this kind of scholarly work, which is really amazing.
You have a really nice place.
We do.
Walking around the renovations, so nice.
Thank you. And you don't have to sit on the floor to charge your phone anymore, which is really great. It's actually pretty amazing. And I would say, another sort of method that we've hopefully opened up access to our building is, so we renovated we have tens of millions of dollars of special collections that prior to the renovation, they would freeze to death in the summertime and roast to death in the wintertime. And so now we have this amazing special collections suite that is actually open to the public. Anybody off the street can actually walk in and say, hey, I want to research my local history from Fox Point, or I want to read a first edition of The Wizard of Oz. And there's something really, really powerful about that.
Yeah.
When you give somebody, a rare material and said, oh yeah, you can touch it. It's pretty spectacular. So I would say, in addition to all the digital and educational activities that we do, that I'm really proud that we have an offering like that as well.
Well, I two things. First of all, I think we underestimate the value of space, and in this pandemic, we've learned both that we can do things remotely, but that also bringing people together under a beautiful space changes the possibilities of how people learn information. I think that's very powerful. And I think your story and your example of being a place where you can come and, you can find The Wizard of Oz online. That's fine.
Right.
But you cannot find the first edition and the engagement with that as art, as stories. It's a very different experience. And again, libraries remain one of the few places that offer that to anyone, right? You can get that by going to some high-end museum, but what libraries do is brings that to everybody, and that is very powerful.
And again, I love to say that it's in a public library, it's free. So, you don't have to worry about paying to get into the museum.
Yep.
Or, all that other good stuff. So I think we only have a minute or so left. So should we go ahead and pivot towards the Q&A?
Let's do that.
And I believe that Christina Bevilacqua is going to be helping us to moderate that. Christina?
I'm here. Can you hear me?
Yes.
We sure can.
Okay. Thanks to everybody who's here tonight, including our wonderful panel, and to all of you who sent questions ahead of time, and we have lots of wonderful questions in the chat. So I'm going to try to kind of combine some of the themes that we're seeing. Dr. Jha, we've had quite a few questions about children, vaccines for children under 5, how masks are affecting children, and a question very topically about how you feel about the possibility of reversing the mask mandate for school children, which some of our neighboring states are doing. So could you talk a little bit about the state of the pandemic for kids and vaccines and masks and all that kind of thing?
Sure. It's a big question with lots of parts. So let me see if I can cover some of it in short order. So one of the ways in which I think we got the framing of this pandemic wrong was by constantly comparing the risk of children to the risk of elderly. Now, it is true and thankful that the risk to kids is much, much lower than it is for elderly. No doubt about it. That turns out to be true for almost every disease, by the way. That's not a unique feature of this pandemic. And the real question that has always been the question that does not get attention, it is not an interest. So I have kids, I have a 10-year-old. The question is not, is my 10-year-old's risk the same as my 84-year-old father's risk? It is not, but that's not the question. As a dad, my question for my child is his risk of COVID comparable to the other risks that he faces, right? That's how we should be evaluating the risk of COVID for kids. If you flip it and ask, how does this compare to other risks that children face? It turns out COVID is actually a pretty serious issue for kids because it is a risk that is higher than many, many other things that kids face. And so therefore, doing things to protect kids, as long as it's not particularly onerous, made a lot of sense to many of us. I've been very much in favor of mask mandates in schools throughout the whole pandemic, and it felt like that was a very important mitigation measure. When the data came out on kids and vaccinations, initially 12 to 17, then 5 to 11, if you look at the data on kids and vaccines and ask the question, not is this more valuable than vaccines in 80-year-olds, because I'm not trying to make a trade-off between my kid and my father, but ask the question, is my child better off getting vaccinated versus not? Are the risks of the vaccines higher or lower than the risks of getting COVID? It's really not a close call. Kids are much, much better off getting vaccinated against COVID. The risks of COVID are small, but they are real. The risks of vaccinations are tiny and much, much safer. So kids should be getting vaccinated. I've been very disappointed to see that nationally we have not moved as much. Right now, about 60% of kids 12 to 17 have gotten vaccinated. About 25% of kids on 5 to 11 have gotten vaccinated. I believe those numbers should be in the 80s and 90s. Kids would be better off. I have 3 children under 18. All of them have gotten vaccinated. To me, this is not just an intellectual issue, it's very personal. All right, let's talk a little bit about masking in schools, because it's been very controversial, and I think unnecessarily so. Masks are important. They help. I'm happy to go through the evidence. The evidence is not overwhelming. It is not slam dunk, but it pretty clearly leans towards masking helps in kids. Are there costs? There probably are. Are they massive? Probably not. People are convinced that somehow masking is going to turn our children into sort of unable to learn languages. I think they're a little bit more resilient than that. That said, I do not believe we should be masking forever. So to the question of what do we do in the upcoming weeks and months around lifting up mask mandates, my personal feeling is in highly vaccinated communities where kids are all vaccinated, older kids are boosted, infection numbers are low. That's a really key thing. So I wouldn't do it in the middle of a surge. I think it's reasonable to remove mask mandates. Doesn't mean you give up all mitigation efforts. I would still have some testing in schools. I would still work on ventilation. I would still do other things, and I would continue getting more and more people vaccinated. In communities with very low levels of vaccinations, it's just riskier. Take the mask mandates off, you're going to see more spread. I would prefer not to do that. The last point is there's a mandate component of this that's a challenge for a lot of people. You know, public health does not have a glorious history of using mandates in ways that promote social equity and well-being. Mandates have often been used as hammers where it ends up being disproportionately impactful in a negative way towards underserved communities. So I'm always very cautious about mandates. I've been very much in favor of them for masks, but I believe that they should come to an end at some point. And we should be thinking about how to use other mitigation efforts to keep kids and teachers and everybody else safe. Last kind of point, masks have, again, just to stay on masks for a second, they elicit this very intense emotion. There are people, every time I tweet about or write about masks, I get simultaneously called, like, suggesting that I'm like proposing killing children by saying we can potentially end mask mandates. And then yet because I've been a proponent of mask mandates throughout the whole pandemic, just an immense amount of vitriol from people who are convinced that masks are horrible for children. We have to take a deep breath. They help. They're not the end all be all. They're not horrible. We should use them when we can. We should mandate it with judiciously, and we should be okay with dropping them when infection numbers are down and vaccinations are up. That's kind of my general thinking on this. So I covered a lot of ground. I'm sure I made nobody happy, but
no, but you made lots of people who asked questions happy, because we had many, many questions about children. So thank you.
Yeah.
We also had several questions about the idea of herd immunity. And someone used the example of the 1918 Spanish flu and asked, how is it that in that flu, where there were no vaccinations, there were very high levels of illness and infection, no medical ways of dealing with it, and yet in 2 years, the Spanish flu ended? And so why 100 years later do we, with all the benefits that we have and with relatively high vaccination rates, why do we not seem to believe, and I'm asking you this question, that COVID-19 is going to evolve in the same way? Or maybe you'll say that it will, but what's the difference between those two things, and how can we think about herd immunity?
yeah. So people often ask, well, how did we get through the Spanish flu without vaccines? By having tens of millions of people die is how we got through it. And, the estimates are between 50 and 100 million people in the world died of Spanish flu. Sure, we could just let tens of millions of Americans die and we'd probably get through this faster. I would rather not do that. I think the 900,000 deaths that we've suffered in the United States is awful enough. And so then there's always sort of the trade-off. And by the way, coronaviruses are different than influenza. We don't know, even if we kind of let it rip and let lots of people die, we don't know that that alone would generate lasting immunity enough that people would not get reinfected twice or 3 times or 4 times. So I am particularly cautious about just sort of letting it go and seeing how it plays out, because my sense is it would play out very, very badly. So the big difference is, right, that we think maybe about 2% of the world's population died of the Spanish flu. That would be a truly horrendous outcome for the world right now. That would be hundreds of millions of people in the world dying, 7-8 million Americans dying. That there's no reason to suffer that kind of consequence. And again, the coronavirus may in fact be worse. So we have a lot of population immunity now. Unfortunately, a lot of that immunity wanes. What I expect is going to happen is, my hope is we develop better, more long-lasting vaccines. The vaccines we have will provide a lot of durable protection against severe illness. For the 20 to 30% of Americans that remain unvaccinated, they will all get infected if they have not already. Most of them will get infected twice or 3 times or 4 times. And maybe after the 3rd or 4th infection, we'll develop enough immunity to be able to manage it. But that's a lot of suffering between now and then. And what I would like to see is not, let's just get to the end game. I would like to see us get to the end game with as little suffering, as little death as possible. And the best strategy we have for that is actually just using more vaccines and getting more people vaccinated.
Thank you so much. That was really clarifying. We have a question here about long COVID and vaccination. Long COVID scares me more than a short stint of being somewhat sick. Having been fully vaccinated and boosted, I could still get a breakthrough infection. Can I still get long COVID even though I have been vaccinated and boosted?
So I know all the questions are coming in about COVID. I apologize.
No, it's okay. I'm fascinated.
So
Reasonable.
it's on people's minds. I think the evidence on vaccinations and long COVID is generally very reassuring. So we're in a place where we're still sorting out what do we mean by long COVID. how long, how severe. All the evidence that has come in so far suggests that when vaccinated people, let alone boosted, let's just talk about vaccinated people, when they have breakthrough infections, can they have persistent symptoms for 4 or 6 weeks? Yeah, we see that with a lot of viral syndromes. But most of the evidence right now, all the evidence so far, suggests if you're vaccinated and have a breakthrough, you're not only less likely to have severe disease, you're far less likely to have persistent symptoms. And if you do have persistent symptoms, they're much more likely to be mild. So I remain very worried about the scourge of long COVID in the unvaccinated population. I remain largely unworried about long COVID in a vaccinated and boosted population. Long COVID is an immunologic phenomenon, we think largely. And when you have been vaccinated, and especially if you've been boosted, you have trained your immune system in a way that makes long COVID far less likely. Is the evidence behind this slam dunk? No, but there's a lot of it, and it all leans in that direction, which is one of the reasons I feel reasonably assured that people who are vaccinated and boosted when they have breakthrough infections are unlikely to have long-term serious complications.
I realize that these questions are all about COVID, but that is what most of the questions were about. So I'm going to go with what the audience is asking. We actually had another question about whether there would be second booster shots, particularly for the elderly. Do you anticipate that?
Yeah, this is a very hard question. The question around second boosters for elderly, because a lot of older Americans who got boosted in August, September, October are now 4, 5, 6 months out and reasonably wondering how much protection do they still have. So let me say what I know about this, what we know. People still have terrific protection against severe disease, that those things continue to be very, very powerful. But you clearly have waning protection against infection. And particularly with Omicron, I think somebody who's 6 months out from a booster probably does not have much protection against infection. Some, but probably not a lot. So what do we do about that? We could do a 4th shot. That's what Israel is trying. And the evidence on this, and I'm a very big proponent of boosters, right? So I'm not anti-booster. Just the evidence that from Israel right now is so underwhelming. You may get a few weeks of maybe this or that a lot of us are really wondering, is the juice worth the squeeze here of asking people to get boosted every 5, 6 months? It raises questions like, what about an Omicron specific vaccine that's being developed by Moderna and Pfizer? We're going to have good clinical data on that in the next 4 weeks. So that may be a better option. I just don't know because we want to see the evidence. And then there is the question of, can we build better vaccines? And the ones that I think are most promising that we've got to put a lot of investments into is intranasal vaccines, because intranasal vaccines, first of all, you get to avoid the shot because for some people there's a needle phobia. But more than that, they generate mucosal immunity in the upper airways, which is how the virus usually gets in. And so they actually have a much better chance of protecting you from getting infected at all. That work is being done. It's not going to be available in the next month or two. It's probably 4, 6, 8 months down the road. So what I'm advising people, including my elderly parents, is hold. No reason to go out and get a 4th shot. Let's see what the data suggests on the new ones. Let's see how this is playing out. Thank goodness the Omicron surge is waning. If you're a very high-risk person, avoid situations where you might get infected. Know that even if you do, you're going to be reasonably well protected with your boosters. And let's see what more information. But I would not right now go out and get a 4th shot. I just can't convince myself that it's going to be worth it. And there may be downsides. There are limits to how often and how much you can boost people without it really just not working very well anymore. So it's not the most satisfying answer, but I would hold for now.
Thank you so much. And now, Jack and Joe, on your toes, I do have a question for you.
We're excited.
This is a question about disinformation. How do you get someone to turn to the library for answers when it is so easy to ask Facebook or other online sites?
It's honestly, it's through education. And I think that's why it's so important that we have school librarians in our high schools and elementary schools. School librarians are the key to teaching kids and students about media literacy and how to basically be able to research trusted and respected and correct information as opposed to just Googling. So I would actually say that school librarians and also the occasional teacher who brings their class to the public library for a discussion about media literacy. But that's a really important question. And unfortunately, our school librarians are under attack in our country right now. Principals across the country are actually seeing that or believing that they're unnecessary, but they're forgetting about important issues like this, that they actually bring real skills to the table and can help kids decide between what's real and what's fake news.
Yeah, I would second everything that Jack said. I don't think it could be said better.
Okay. Hang on a sec. Things are moving fast over here. Back to, I guess this is another vaccine question. Will we expect to get vaccines every year like with the flu?
So very good question. Will we need annual COVID shots? Again, will we need them every 6 months? I think of this in kind of two phases. There are a set of vaccines that we will need while we're still in the, let's say, the emergency phase. I shouldn't even use the word emergency phase anymore, but maybe the acute phase of this pandemic. And that will be with us for a little bit longer. As I said, I expect more variants. I expect more surges. And we may need a pretty aggressive vaccination strategy to keep people protected while the virus sort of does this. Once it settles down, we may need vaccines maybe every year, maybe every few years. We will work on more durable vaccines. We will work on, as I said, intranasal and other types. We'll work on vaccines that are pan-coronavirus vaccines, that one vaccine will work against all the different variants. All of that is being worked on right now. Some of those are longer term, maybe a couple of years away. I would not be surprised if people need an annual shot for the next few years, maybe even every 6 to 9 months for the next year or two. And that's not great. It's not terrific. But my take is, if that's what it costs us to save millions of lives and that is something we can do. That is something we can do, and that is something we can manage. So there's a lot more to learn here. I would be very surprised if we don't need any more vaccines. But my mental model probably says most likely about once a year for the next few years until we get into a better phase with this virus. And that's okay. Like, that's not a big deal. Okay. I get my flu shot every year. If I have to get a flu shot and a COVID shot every year, I don't know. If that's what it takes to defeat this pandemic, it's not a problem.
So we had a question about, I think one of the things that has been really shocking for many of us is we live in a country where the response to the vaccine has been so different and we're very polarized. We had a question about whether public libraries in states that have been more open to participating in trying to give information about the virus and vaccines, et cetera, can be working with public libraries in communities where there is more political opposition or, real disinformation coming even from governmental sources. Jack and Joe, and Dr. Jha also, any early signs of something along those lines, the network of libraries?
I have to say, I don't think I've heard about that being a phenomenon, but I will say that public libraries around the country are considered bipartisan spaces. There's legit cooperation between our two political parties in supporting public libraries, and there's a real understanding there. So I would imagine that there would be some cooperation. I know that many public libraries, like the Province Public Library, we actually have vaccination clinics here a couple times a month. So we're trying to help out folks in that way. And then, like I said, we also can have, programs like this to support people. But I have not heard specifically about the topic that you're describing.
I think, Jack, if I'm correct, the whatever the kind of polling around this is, that public libraries are among the most trusted institutions in our country. And I know you wear that responsibility very seriously in being that open.
We do. And, especially for new immigrants who are coming into the country who have no place to go and have no access to technology, we're the first stop. I have so many actually friends who are librarians who are new immigrants to the country, and they got their first job by coming to the library and working on their resume. So absolutely, we are that trusted place.
I think we have time for one more from the audience, and then I'll just ask one sum up question and then turn it back over to Jack. This is a really interesting question. What can public libraries do over the summer, particularly to help children deal with learning loss due to COVID?
Sure. So summer reading is a nationwide phenomenon. There's a study. There are multiple studies out there that if kids continue to read and study throughout the summer, then they will not have that loss of literacy skills, so they can start school in the fall ready to learn. And again, this is a nationwide project. I think probably many of us from all ages of life can say that we probably participated in a summer reading program. But also, libraries have other learning programs. We had libraries across the country where they had outdoor story times. They had kits that kids could take home and create and make and learn things with their parents, around STEM or around gardening, all that. I mean, it basically ran the gamut. And then, also institutions like Providence Public Library and other libraries, we actually have learning initiatives throughout the year, not just the summer, where kids can come in and take a 10-week course online if we're experiencing a surge, or in person, and then get actual credit towards your high school diploma or towards an undergraduate degree at a local university. So we are trying to support learning however we can. I always say that public libraries are the safety net for folks who actually can't make it in the formal learning system. So we take that perspective, but then we also are, we welcome anybody who wants to come in and learn, during the summer.
I'll just add a footnote to say that this is a space that many university libraries have also been active in, supplementing the great efforts of public libraries. And it is a category of activity that is something we are planning to contribute to as part of Brown's overall work in the Providence and Rhode Island community, and so that we can contribute as well. So hopefully a conversation in the future will have more to say about that.
Wonderful, thank you. I wanted to just ask a last question of each of you, just a reflection on what's the most important thing you've learned in this past 2 years, something that you will carry forward in the work that you do in the future?
Well, I'll quote somebody that I work with, and I feel like that I've had when I asked her if she wanted, to look at any professional development, she said that she had a 2-year crash course in crisis management. So I think that I'll say that I've learned that.
I think very similarly, it was a time where we tore up the playbook. How we operated the library for the rhythm of our semesters and our course offerings and so forth was fairly well established. We had to reinvent all that on the fly, ensure that our university was continuing to teach, continuing to do cutting edge research on really important questions like COVID. And we had to figure out very quickly how to do that in very new ways. And that was quite an amazing experience. And to be with a group of colleagues doing that, I think I will carry that with me forever.
There's been a lot of lessons, I think, for me in the last 2 years that I will carry. I will maybe pick one that feels particularly salient at this moment. So I think many of us had a mental model in academic public health of our job was find a public health problem that's important, do the science, gather the evidence, write it up, publish it, get it out to policymakers, and your job is done. And I think what this national, international, global health crisis taught us is that public health begins with the public, and that engaging the public, understanding the anxieties and the uncertainties that the public feels, and addressing it head on and with honesty and openness, even when you don't know the answers, is not a nice thing to do in public health. It is essential to public health. And I think many of us, and I'll speak for myself, did not appreciate the importance of that. And I think that the importance of that will never be lost on any of us again if we face future health crises. And that has probably been my biggest lesson.
Thank you so much. Thanks to all of you. This was such a wonderful conversation. Jack, I'm going to let you close things out, but thanks again to everyone for coming and for your wonderful, wonderful questions.
Thank you, Christina. And thank you all for joining us tonight. Thanks especially to the members of our Conservative Society, but also everybody else who's joined us virtually. Ashish, Joe, it's been a true honor sharing the stage with you. I know that I've learned a lot, and I think that we've uncovered quite a lot of new information around this topic and talked about libraries all the same. So thank you both for joining me tonight. It's been a real pleasure. Over and out.
Thank you. It's been a pleasure.
Thank you. It's been great.
Thank you.